get up? You wanna get up? Do you wanna get up? High five. Hi. Now you stop talking. You wanna say something? You can say something? So it's Monday. Emerson's taking a nap right now. I almost totally forgot that she had a COVID test on Saturday. So good thing I remembered. What? She had to have another COVID test because she's having an MRI on Tuesday. He does not like that I'm talking and not paying attention to him. Emerson's having an MRI in preparation for a hip surgery. Basically, sometime last year, we determined that she was going to need another hip surgery. Her right hip, I think, looks okay and it's maybe improving, but her left hip is not very stable in the socket. So we're going to have another hip surgery. Her first one was around 5 months old. Even though Emerson's not walking and she's not really close to walking right now, they still want to go ahead with surgery because if she doesn't and we keep putting it off, there's a chance that she'll develop arthritis in her hips, which would be way harder to treat than her hip dysplasia. So the plan is to have another hip surgery. Emerson actually had another MRI last July, and based on that MRI, they determined that we were going to need sclerotherapy before we proceeded with her hip surgery. She has all of these venous malformations. Wherever they would make the incision, I think there's a big malformation right there. If we cut into that, there's just risk for bleeding and infection. So she had 4 sclerotherapy treatments. They inject something into the vein to try and shrink it and kind of cause it to collapse on itself. The MRI tomorrow is just so that we can make sure that everything looks good, everything's ready for surgery, and then we'll proceed from there. With Emerson's surgery when she was 5 months old, they didn't really determine what they were going to do until they got into the OR. Hi. What they ended up doing, since they couldn't get the hips to be stable enough in the socket without making an incision, they made small incisions on the inside of her hip and then went in and stabilized the hip. They didn't like cut any bone or add any hardware or anything. What's happening with hip dysplasia is that you have your hip socket and you have the femoral head, and the socket is really shallow. It should be like this to keep your femoral head from moving around, but since it's so shallow, it's not stable and it can just kind of move in and out of the socket. The plan for surgery this time is most likely to cut some bone and add some hardware to try and force that shape to keep the femoral head from moving around. Her doctor did say that there's a chance that she won't have to be in the cast again, which I'm really hoping for. Lugging Emerson around in a spica cast when she was 5 months old versus 4 years old, it's gonna be a big difference. A 40-pound child in a spica cast? Is that even possible? I don't know. Emerson was born with hip dysplasia. The official name for it is developmental dysplasia of the hip. Girls and firstborn children are at higher risk for having it, and so she had both of those things working against her. Probably had a lot to do with her condition as well, since that tends to affect her tone and her joints and all of that. Our first priority was treating her seizures, and so we put off hip treatment. Looking back, we started seeing ortho around 2 months, so we really didn't put it off for that long. We'll hopefully have a plan for surgery in the next few weeks. After her MRI tomorrow, I know her surgeon wants to meet with us again to go over the plan. I don't know when this is supposed to happen. Hopefully in the next few months, but if she has to be in a spica during a Texas summer, then we're never gonna go outside. So the MRI is probably our biggest thing this week, besides some COVID follow-up visits for Emerson and Rhett. Except my family's coming into town on Saturday. Can't forget about that. I guess it's also Valentine's Day this week. Maybe for Colin's gift, I'll just clean off the counter like he's been wanting me to do for months. So it's Wednesday. We're just getting out of Rhett's pediatrician appointment. Yesterday was a day. Monday was great. Rhett slept every 3 hours. He didn't fight any of his naps. He took naps at the perfect time, which gave him just enough time to be tired to go to bed at like 7:30. I don't know. It was just a really good day. So of course yesterday had to be crappy, just in contrast. Maybe it's just because Monday was so great that Tuesday seemed so terrible. He was fighting all of his naps, screaming. 2 of his naps were only like 30 minutes long. That's not enough time to get anything done, so that was not fun. But Emerson was at her MRI, which that went well. We're just waiting on results now. But since Grandma took her to that, I had Rhett by himself for the morning. The whole time I'm just thinking, oh man, one kid is so much easier. It's just funny because when I had Emerson, I thought having a kid was so hard. Just one. I mean, she had a lot of stuff going on. I guess moral of the story is, it doesn't matter how many kids you have, being a parent is hard. I guess that we're supposed to be getting some sort of Arctic blast or Arctic chill. I don't know what they're calling it. It sounds like a Gatorade flavor. So it is really overcast and foggy here, and it's supposed to get really cold, so I'm kind of excited about that because we don't really get a lot of cold weather in Texas. So the only thing left to do this week is celebrate Valentine's Day. We pretty much plan everything around food. So we're going to be going to a restaurant that Colin has been wanting to try for months. So we'll go out on Friday night, and then my family will get here on Saturday, and we'll see what happens after that. So Grandma and Grandpa took Emerson on a little field trip. I don't know where they are. But what that means for me is while Rhett takes a nap, I get to eat my food while it's still hot and take a shower all before noon. So hopefully that means today is going to be a better day. Wow, that's really bright. So since Rare Disease Day is coming up at the end of this month, I'm going to try and make a video basically just giving you an overview of Emerson's condition, things you might need to know about her. It'll probably be a pretty long video. Her condition is really rare, so I'm not surprised that not a lot of people have heard about it, which is totally fine. I'm going to try not to give you everything because you don't need to know everything. And then I'll try and add on to that video just answering some of your questions. Last year, I did a Q&A on my Instagram stories, and you guys had a lot of good questions. The whole purpose of this is I want you guys to be comfortable asking questions that you don't know. All this is typical for me. I mean, you guys could be interested in things that I have not even thought about. So you tell me what you want to know. I'm hesitant to say this. There's probably no question that is off limits. I mean, you guys can be as personal as you want. I am a pretty open book. We'll try not to get too personal though. I do have to say though, Colin the other day said something to me along the lines of, you know, I could be in more of your videos. So I think that we're gonna have to show Colin in these a little bit more. I think you guys would enjoy these a lot more if you could see Colin because he's funnier than I am. And he's got way more energy than me, so he's probably gonna be a little bit more dynamic. Red. Hi, baby. Oh, you want him all day? Outside. Show me. Outside. Good girl. her socket is really shallow, and what they're trying to do is make